And also, thank you for tuning in for those who are watching live streaming of this press conference. My name is Kamoshida Naoaki. I'm Director for the International Press Division of the Ministry of Foreign Affairs, and I'll today serve as a moderator for this press conference. The aim of this press conference is to brief you about the meeting of the headquarters for measures against the coronavirus disease of the Japanese government, which was held today. Let me introduce briefers for today. Next to me, we have Mr. UYAMA Tomochika, Director General at the Office for Coronavirus Disease 2019 Preparedness and Response at the Cabinet Secretariat. And to his left, Mr. TAGUCHI Kazuho, Director of the Office of Global Health Corporation from the Ministry of Health, Labor and Welfare. So I will ask Mr. Uyama to make some introductory remarks and then open the floor for questions. So without further ado, Mr. Uyama, please.
Good evening, ladies and gentlemen. Thank you very much for coming at this very late hour. I'd like to take this. My name is Tomochika Uyama. I'm the working for Minister Nishimura, who is the minister designated for this coronavirus countermeasures in the cabinet. And what I'd like to introduce today is what happened today concerning the government headquarters meeting, which is headed by Prime Minister this afternoon. And this meeting was preceded by the, as usual, the advisory committee meeting on basic action policies, which is a gathering of experts, and where the government consult with this advisory committee. And then there was parliamentary sessions for both houses, and then government headquarters meeting. And also there was a press conference by the, there's a press occasion for the Prime Minister, also a press conference by Minister Nishimura as well, just before this meeting. So on the basis of mainly what Minister Nishimura said, I just would like to introduce the results of this process. And what Minister Nishimura said at the press conference is, first is there was today the government lifted the state of emergency from Kyoto, Osaka, and Hyogo, 3 prefectures. So therefore, as you know, the 5 prefectures, only 5 prefectures remaining in Japan. One is the wider Tokyo area and also Hokkaido. The reason why this action happened is, of course, it's on overall considerations, but it includes that there are first one is new cases of infection decreased and went below 0.5 per person per 100,000 populations. This is the sort of 1 week count. And the second element is the medical services and also surveillances are in good conditions. So those are the kind of overall, part of the overall considerations. This application of this state of emergency was lifted. Including the 3 prefectures, which I mentioned today, there are now 42 prefectures where the state of emergency is not applying. And therefore, there will be an increase of social and economic activities, maybe very gradually, step by step. And the Minister Nishimura stressed the importance of continued countermeasures taken to prevent the expansion of infection, including what is called the very famous 3 C's in Japan called sanmitsu, what is first of all a closed environment. The second one is a crowded environment, and the third is close contacts, and particularly in case of loud voices. So what is called sanmitsu in Japan, and I think some experts say 3 C's. This is a very commonly shared and understood among Japanese public. And also, it's very important to keep the social distance, and also using some of the tools like acrylic board in certain places to make the prevention measures for the infections. So those are really important to be continued, some countermeasures. And also, Minister Nishimura also stressed is that there are certain sectors, particularly 4 sectors, where in the past in Japan, clusters happened. One is the certain restaurants and bars, and also where the very close human-to-human services happens, and also karaoke bars and so forth, and also live houses, and also sports gyms. So those are certain kind of cases where the cluster happened before. So Minister expressed that to please take a very careful stance for those to using for those places. And also he also stressed that while the emergency measures are lifted, where those prefectures emergency measures are lifted, people should be very careful of crossing the prefecture borders for the time being, toward the end of the month at least. So this is what is said. And what is always important paper is the action policies paper, which is based on the law. And there are certain changes in addition to this lifting of certain prefectures. And the first one is the surveillance. And because of the introduction of the antigen tests in addition to PCR, so though the role of PCR, the role of antigen tests must be further considered and assessed. And also, secondly, the new sort of policies also stress the importance of expansion of the PCR test, in particular for medical personnel and also those people who have close contacts. And also, the Minister Nishimura also pointed out where the economic and social activities are going up. While this coronavirus is still there, guidelines are being now prepared for each industry. And at this stage, we have now 101 guidelines for industries, and we are expected to have 128 in the meantime. So this is a very important guidelines to continue the business, increase and continue business activities while having these countermeasures for the against the expansion of this infection. and the government is continue to support industries on this basis. While remaining prefectures, which is Saitama and Chiba, Tokyo, Kanagawa, and Hokkaido, there will be continued the same level of efforts will be made. And but since the trend is new cases more or less decreasing trend, and also the medical supplies situations is improving. So therefore, if this trend continues, maybe we don't need to wait until the end of the month. And therefore, this also, of course, said by the Prime Minister, we decided to increase the opportunity to evaluate the current situation and analysis. And today it was announced that maybe around 25th next week, there will be a consultation with the experts, and government is expected have some analysis and assessment as early as 25th. So Minister Nishimura continues said those people in these 5 prefectures need to continue to have a big burden, but he really appreciates the understanding of the people of self-restraints of those people, including staying at home, and why this kind of efforts is really important to realize the new phase of development happens maybe next month. And also the last part, Minister Nishimura stressed the importance that he really wished to end this big wave by the end of the month. And after that, maybe coronavirus still there, but we don't want to have another big wave, but try to keep it small. And also by keeping these countermeasures, but we would like to increase our social and economic activities step by step. And he also stressed the importance of a new lifestyle and what we call smart life. And he stressed the importance to continue the collaboration with the medical people and the prefectural governments, industries, and experts. So this is the results of this process, and I'd like to invite the questions. Thank you.
Thank you, Mr. Uyama. So I will open the floor for questions. But for those who are viewing live streaming, please send. If you have questions, please send them to the email account of the International Press Division. And so we accept questions from those who registered themselves for this press conference in advance. So I will take questions from those participating in person. So from the floor, do you have any questions? And if you have questions, please raise your hand and state your name and affiliation before asking question. Mr. Swift, please.
Thank you. Rocky Swift with Reuters. Just with regard to Tokyo and the greater Tokyo area, the Governor Koike had mentioned that part of the criteria for relieving the emergency status would be seeing daily new cases of coronavirus at 20 or lower. And lately, it's been 5, 10 a day. So it seems to be there already. Can you comment any further on what sort of metrics or numbers you might be looking at so that the greater Tokyo area could be relieved from the state of emergency? Thank you.
Thank you very much. I think because of the situation of today, we look at the 1 week span of these new cases, and one of the threshold is 0.5%, 5% per 100,000 people. So according to this, and also there's a consideration that Tokyo, Kanagawa, Saitama, and Chiba are very well integrated in economic areas. So people need to consider in the overall situation, not just one prefecture. So having said this, as I said, there's a trend of improvement day by day, and that is correct. And so I think there are sort of updates of assessments as early as 25th, which is a Monday next week. And so as a government, we rely on the advice from the experts. And based on such experts, there's a possibility of some decisions next Monday, but we don't want to make any prejudgment as of today. But there's, I think, a common understanding. There are improvements recently, including Tokyo and some other prefectures. Thank you.
Do you have other questions? So far, I haven't received questions from the online viewers yet, but maybe we have to wait for a few minutes before they may take some time for typing in questions. So meanwhile, if those in this room have other questions, we're happy to take. So Mr. Swift.
Sorry to monopolize the floor. Rocky Swift with Reuters. Let me ask 2 brief questions. You mentioned that one statistic of 0.5 per, is that fatalities? Per 100,000. Can you give a little bit more perspective about why that number, why that statistic is important epidemiologically? And second, we have seen or heard some reports that some smaller clinics within Japan's medical system is kind of fragmented. There's many small doctors and clinics around, have seen a decline in foot traffic since this sort of crisis has started. There's been more of a trend towards telemedicine and on other things. And that, the sort of the regular economics of medicine have broken down a bit in this crisis. Do you have any kind of strategy or response to the hardships of smaller doctors and clinics going forward in this environment? Thank you. Those 2 questions.
Thank you very much. Thank you very much. The basis of this criteria, actually, I have to emphasize, this is not the only criteria. And there is no really mechanical application of just one criteria. But in the end, there will be overall consideration, in particular, these new cases, but also medical supply and also surveillance. So those are 3 very important factors. So this is just one of them. And having said this, why 0.5 per 100,000 is that this is a situation where the Japanese government was able to detect and address the cluster of each cluster. And before this state of emergency was declared. So what we have in mind is a state of emergency and asking people to come back to the situation where we were able to have this kind of effective cluster approach is effective to keep these new cases low. So and this is the kind of basis why we have chosen this particular number by experts. So I think I'd like to ask my colleagues to answer the next question. I just wanted to add this. So this is the situation where our cluster approach was very effective. Was roughly in the middle of March. That was the situation. So if you think we came back to that situation, so we can lift the state of emergency. That's our thinking. Thank you. すみません。
はい。Let me add some additional information. So in the preceding advisory committee, it is included in the recommendations. In the last 1 week, the cumulative new infection should be no larger than 0.5 person per 100,000 of the population as of the 14th. And as is described in Germany, per 100,000, the new infection cumulative in 1 week is less than 50 individuals. Or in the state of New York, the new hospitalization, so definitions are different, but new hospitalizations per 100,000 should be not more than 2 days as an average of 3 days. So as was mentioned by UYAMA-san, this criteria in the case of Tokyo means that before there was an explosion at the beginning or the middle of March, that was the level of the new infections per population. So that is the number referred to according to the advisory committee's recommendation. And the second question is also about the medical services. If there are persons suspected of COVID-19, they might be concerned and they may rush to hospitals, and infection might spread in waiting rooms, which could lead to in-house nosocomial infections. That has been the concern. So from the beginning, if there are people suspected of infection, they should call the call center for returnees and contacts rather than going to hospitals directly. And only after that, a specific outpatient ward for returnees and contacts would be taught. And by doing so, we had tried to prevent suspected infected persons visiting other medical institutions. As the reporter from Reuters has asked, it does have impact. And you have mentioned about the decline of visitors to smaller clinics, which we take it seriously. So for non-corona medical services, it is important that be maintained. It is important that medical services for non-corona be provided. We are conducting hearing, asking questions to medical institutions, and countermeasures will be considered.
Okay, thank you. So now I have some questions coming in from online viewers, so I'll turn to them. The first, we have three questions from Mr. Patrick Welter from Frankfurter Allgemeine Zeitung. His first question is, can you give an example and more detailed explanation about the content of the guidelines by industry? Who is setting up these guidelines? So can I ask Mr. UYAMA?
Thank you very much. Actually, these guidelines created by each industrial group. For example, there are so many, but there are some sort of guidelines made by these supermarket associations. And one of the example is the, for example, in order to not to prevent any infections, there are some, if there's an elevator or escalator, there are certain measures being introduced to not have too much crowded in such places, and also allow the elderly people or people who are pregnant and handicapped people need to be taken care of. And also, staffs must be have very frequent wash their hands, and also there are certain sanitary measures need to be taken under certain appropriate places. All these are each of these measures are kind of very specific and very small, and it's very kind of suitable for each of the industry. How what kind of wisdom can be utilized to continue their business while keeping these countermeasures. So those are sort of created by the consultation of each of the industries. So this is very encouraging, and so the government would like to support this kind of guidelines and how to make this business, economic activities compatible with the coronavirus countermeasures. Thank you.
Thank you. The second and third questions from Mr. Patrick Welters are, the second question is, seeing the end of the state of emergency, when is the government planning to lift the international entry restrictions to Japan? And the third question is, when does the government plan to allow foreigners living in Japan to re-entry after leaving the country? Please allow me to answer these questions together. As you know, these restrictions of going back and forth across the borders are introduced in order to prevent the spread of infectious disease. And in order to allow restarting the people's exchanges, first we have to get under control the infectious status in Japan, and also we have to closely examine the situation overseas, including the status of infection in each country, or the status of medical system in each country, like that. So comprehensive assessment is necessary in order to consider what kind of approaches we can take to restart allowing people come and go or across borders. And also, when we relax the restrictions, we may need to take a phased approach. For example, starting by allowing people or essential for business activities or experts coming in and out. And then after that, the general public, including tourists, may be allowed to come and go. And also with regard to countries as well, we probably have to start from a group of countries where infection is under control. So that is the current thought about how we could lift the entry restrictions, but at the time, at this stage, I'm afraid we cannot say exactly when this will happen. So let me turn to a question from Mr. Jake Sturmer from Australian ABC. His question is, do you have any clearer picture as to why Japan's number of COVID-19 deaths has remained so low compared to other Western countries?
I think my colleagues from the Ministry of Health will perhaps add. But just I want to say this is a very good question. And we'd like to spend more efforts to explain and find out. And at this stage, there are a lot of theories why Japanese numbers of deaths are so low at this stage. And some people say we have a usual practice of wearing masks. That is true, but this may have some connections. And the Japanese tradition of take off shoes before go to a house. This may be some links. So there are many sort of theories of why doing it. But when I consult, maybe it's true. And when I consult with some of the experts, and they stress the importance of two things. One is Japanese medical capability, and also because of the universal health coverage. There's a Japanese in Japan. People have a good access to medical services, and the medical services level is quite good. And so detection of some of the problems of these new diseases were detected quite early. And also, this is one of the reasons. Even at the very rural areas, they're quite good access to good medical services. And the second is there's on the basis of that, there's a great efforts of collaboration between government and experts. And experts was really looking at what kind of disease this is in the very early part of the stage. And step by step, they found out maybe the key to tackle this disease, maybe there's a cluster. So we spend so much time and energy to address this, find the cluster and address them. And if you find a new case, people made tremendous efforts to find backtrack link. Who was the cause of this new case? And try to find a cluster. And and by doing it, there was a kind of analysis where this cluster may happen. And there was some kind of conclusion of sanmitsu. This is a cluster quite often happens when there's a closed places, closed environment, and crowded gathering, and also close contacts, particularly big voice, including like singing, shouting, and so forth. And those are the clusters where the clusters quite often happens. And by catching those clusters and their work time, we were able to contain quite a number of cases. But of course, there are increase of numbers. But this kind of 3 Cs continue to be the main message to the Japanese people. So while the state of emergency happens, people really have in mind these 3 Cs. Try to avoid 3 Cs. This is really many people, the Prime Minister, ministers, health minister, governors, always stress, please try to avoid 3 Cs. And this is actually maybe we have to look back and reconsider, but quite effective, maybe in preventing new clusters. So that seems to be working. But this is a view of one of my experts, and but this seems to be quite a useful view. But I think we think we need to look an eye and try to share our experiences with the rest of the world. Continue to do that. But would you like to add something on this?
Thank you very much. I'm in complete agreement with what was mentioned by Mr. Uyama. If there's anything to add, first of all, can we conclusively pinpoint a reason at this juncture? Not yet. But on the other hand, when we explain the efforts that have been taking place in Japan so far, then we were quite early in detection, and when tests are done, we performed tests in a way that people don't flood the test centers that could cause yet another wave of infection. So mechanisms were in place to do the tests properly. And in open space, 80% of the cases in outdoors were prevented. In other words, 80% of the people were not transmitted. That was the data we obtained early on. So we came up with the 3 Cs and called upon the citizens to change their behavior. And the health centers quite aggressively took counter-cluster measures and conducted contact tracing and tenaciously conducted those tasks, partly through the efforts delivered by experts. Japan has ensured universal health coverage. All the Japanese nationals are insured, and we are proud of this healthcare system that is not behind any other nation. So CT prevalence is also very high in Japan. To detect lung diseases. So with the cumulative efforts made historically by the people in the medical services, here we are today. And as Mr. Uoyama said, there are certain sanitation practices amongst Japanese. For example, Japanese people were early in wearing facial masks. Even before the announcement of the declaration of state of emergency, many Japanese people were already wearing facial masks. Thank you.
Okay, thank you. Let me turn to another question. This is from Mr. Walter Sim from the Straits Times. His question is about antibody tests. There has been some research studies on antibody tests, including one that shows that as many as 80,000 Tokyo residents might have been infected. I understand that the Japanese government intends to conduct antibody tests going forward by testing 10,000 in Tokyo, Osaka, and Miyagi. Could you elaborate on the aims of this study, including how it intends to use the data, and whether it might show that Japan has achieved so-called herd immunity? So, may I ask this to Mr. Taguchi?
はい、
Thank you. About the antibody testing, let me respond. The WHO says that this could be done for people with symptoms. It could not be recommended for people with symptoms, but it could be useful for epidemiological purposes. But for COVID-19, after infection, whether antibody could be produced, that is a high possibility, but the presence or the antibody level and the link with reinfection, the endurance of the antibody being maintained in vivo, that have not been clarified. Because of such circumstances, the use of the antibody test, it will be considered very carefully. As for our position, AMED, AMED, at the research group by AMED, they evaluate the accuracy of the test kit, or they study the prevalence of antibodies. Such studies are ongoing by such institutions. Going forward, the antibody tests that are planned, the aim is for the Japanese society as a whole to try to understand the level of antibody carriers. That is the aim. We are not trying to reach herd immunity. So experts of statistics and other areas advices shall be garnered, and if early from June, multiple local government authorities will start this test for the general population, a total of some 10,000 or so individuals, hopefully, it will be tested. As for the locations, there are areas with infection circulation and areas without circulation. We are thinking about mixing. We are still considering the plan, so there are some information I cannot be clear about, but we will continue with this plan carefully.
Okay, thank you. Now I have, 6 questions from Mr. Martin Kerling from Handelsblatt. So let me address first 2 questions. First, the first one is why is the hurdle so low? 0.5 new infections per 10,000 persons per week, especially compared to Germany. According to your experts, 50 cases to 100,000 persons. The second, so 0.5 new infections per 100,000 is a Japanese standard, sorry. So why is the hurdle so low? The second question is, would you be able to follow more cases with smartphone data usage like in Korea? So maybe my colleagues may wish to explain about the development of application, for example. But could you answer these 2 questions?
Thank you very much. Thank you for those questions. I think more or less I already answered the first question. The first answer is this threshold, we'd like to go back to the situation. We had a very effective cluster detection and address the detector policy in the middle of March, and the why Japan is so low compared with other countries, including Germany, is something I already explained earlier. So maybe I don't need to perhaps repeat what I've said. The second question is smartphone data. As you already usually know very well, we use the smartphone data, big data, when we detect the effect, how effective our self-restriction was during the state of emergency measures in place in certain areas. Before this state of emergency applies, what percent of the traffic or population were achieved? So those kind of data is used, and we also exploring and willing to move to the situation where we might be able to use the apps, smartphone apps, to detect the a close contact person. So this is something we are sort of looking forward to promoting the possibility of for future use. Thank you.
Do you have something to add, Mr. Taguchi?
Thank you. The use of ICT is very important for efficient tracking of the situation. So on HERSIS is one system that we are developing to track the infected people. And from the 15th, some municipalities are already using this system, so that this system will be expanded. And at health centers, for patients and close contacts, information could be input. And by inputting such information, that kind of information could be used for follow-up. HERSIS stands for Health Center Real-Time Information Sharing System on COVID-19. And we're also considering the development of applications, apps. In Japan, the counter-cluster measures were introduced. And with better use of ICT, we're hopeful that the level of efficiency can be elevated. Thank you.
Thank you. So let me turn to the third and fourth question from Mr. Martin Kelling. These are related with each other. The third question is, why does Kanagawa still have higher case numbers? And the next question is, what happens with the state of emergency in Tokyo if the numbers in Kanagawa stay above the limit?
Thank you very much. Maybe again, my colleagues maybe in a better position to answer those questions. But just I wanted to say, during today's press conference where Minister Nishimura, Dr. Omi, who is the chairman of this the committee, was there, and there was a same kind of question there, and he was saying that his view, Kanagawa apparently is a kind of a little late in terms of new cases following Tokyo. So Kanagawa seems to be kind of a time difference in following Tokyo's situation. So this was his impression, but maybe my colleague might be also wants to answer this question. And the question number 4, the last question of this is again, Tokyo, Kanagawa, Saitama, Chiba are considered to be the integrated areas people in some prefectures, neighboring prefectures, commute to Tokyo. There are many people like that. So you can't really separate and make a decision on each of the prefecture. So that's the overall consensus of the experts. And so people wish to, I think experts, it really depends on experts, but experts' view is that they really wish to make an overall assessment of these 4 prefectures and make a decision in overall, not just one separate prefecture to another. So, even one prefecture is the situation, the improvement is a little less than other prefectures. It depends on how we can look at the overall picture. So that's, I think, what we can say. Thank you.
Okay, thank you. Fifth and sixth question from Mr. Martin Kelling is about border measures. For the fifth question is the EU, European Union, allows Japanese businessmen to enter from Japan, at least if they have visa. But Japan does not let long-term visa holders in, which is a very unequal treatment. When are you going to change that? And the sixth question is, why are the borders close to South Korea and Taiwan, which are in a way better states than Japan? And for these questions, I'm afraid I have to repeat myself. In order to relax the restrictions on border, first we have to get infection status in Japan under control. And although the numbers are improving, as you know, the Tokyo and other neighboring areas are still under the state of emergency. And also we have to closely examine the situation in each country, including the status of infection or the status of a medical system or other various elements. And so after this comprehensive assessment, we can consider what approach we can take. And so at this moment, I'm afraid we cannot say when or for which country we can relax the restriction. So we also have a question from Mr. Alistair Gale from the Wall Street Journal. Question is about antigen testing. What is the sensitivity, specificity of the antigen tests that Japan has approved? Could I ask this question to Mr. Taguchi?
On the 13th, Fuji Rebio's antigen test was approved within a very short time. The test can be conducted. After collection of the sample, the results can be reached within 30 minutes, 30. For the positive cases, this is highly reliable, and therefore, first of all, doing the antigen test, and then for the negative results, upon necessity, PCR will be conducted additionally following antigen test. We think that would be possible. In Japan, the PCR test cases, it is like 8,000 or 10,000 tests per day in Japan. But this antigen test, about 200,000 per week can be tested. That is the supply capability of antigen testing. Therefore, going forward, how to do the test, we have a big expectation. About the sensitivity, I have not brought the information, but on the 13th of this month, the Bureau of MHLW has approved this test kit of Fuji Revio, and the press release has been issued. I do not have the statistics, but relevant data is provided, so if you can find the press release as of the 13th.
So far, these are all the questions I have received from online viewers. From those in the floor, do you have any additional questions? Those in this room, from those in this room, do you have any questions? No? Okay. So if not, I would like to conclude today's press conference. Thank you very much for your attendance. Thank you.
Thank you very much.